The relationship between acetaminophen during pregnancy and the risk of conditions like autism and ADHD wait, this feels like deja vu, but it's still the topic of this week's Healthcare Triage. There are limited options for pain management during pregnancy, mainly thanks to concerns over how various medications would affect the fetus. One option considered safe is Tylenol, which also goes by names like acetaminophen and paracetamol. While we've had decent data on the safety of this pain relief option, we've got some even better data now, which is good news for any nervous parents-to-be with a nagging headache. To the research. In April of 2024, a study was published in JAMA, where researchers examined data from nearly 2.5 million children born in Sweden between 1995 and 2019. Medical data from places like Sweden are notorious for being both thorough and complete, and these researchers had access to records where mothers were asked often during pregnancy about their use of acetaminophen. They used these data to examine diagnoses of autism, ADHD, and intellectual disability in the offspring of these mothers, including a comparison between siblings of mothers who chose to take acetaminophen during one pregnancy but not another. And what did they find? No relationship between acetaminophen use and offspring outcomes. It's the sibling data obtained from such exceptional medical records that sets this study apart from other data we have on this topic. While a randomized controlled trial would give us the best answer, that isn't really an ethical option in this case. So observational studies are the best we've got. However, previous studies have lacked both the sibling analysis and this type of record keeping, which is way better than asking mothers to recall their acetaminophen use at a later date. What illustrates this point nicely is that the authors first analyzed the data without doing a sibling comparison. In this analysis, use of acetaminophen while pregnant was associated with an increase in autism and intellectual disability. This is similar to previous studies we've covered before, those ones with all the caveats that make the results questionable at best. When the authors pulled in the sibling controls, which eliminates several potential confounding factors, there was no longer any evidence of a relationship between acetaminophen use during pregnancy and autism or intellectual disability in the offspring. Note that no relationship was reported with ADHD in either case. This was true even for mothers who reported the highest use during pregnancy. This is likely the best data we're going to get on this question, and it's pretty good. And we were already feeling pretty good about the answer before this. So, you people creating life, you've been through enough. Don't add unnecessary headaches to the mix. Hey, did you enjoy this episode? You might enjoy this previous episode also on the relative risks of acetaminophen, ADHD, and autism. We'd appreciate it if you'd like this video right down there and subscribe to the channel right down there. And maybe go on to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joe Sevitz and Edward Lillaholm, and of course, our Surgeon Admiral, Sam.